Thank my colleagues, North Carolina, for extending the courtesy to be able to proceed. We've been moving back and forth, and I understand there was 20 minutes left for the Democrats, and a senator from Pennsylvania's taken 5. And am I correct? How much time is?
15.5 minutes remain.
Well, how much do we have? 7? Yeah, 7 minutes. 7 minutes. Is that right? I would yield myself 7 minutes, and ask if the chair would remind me when there is 1 minute left, Mr. President. Mr. President, this debate and discussion over the course of the day has been, I think, enormously constructive. I think American people have been watching it. They have a much clearer idea about the alternatives that are before us. They should know about this time that when all is said and done, this program, the SCHIP program, was fashioned and shaped to try and look out after the working poor, recognizing that Medicaid dealt with the very poor, but the working poor were finding increasing pressure, increasing numbers that were unable to get any kind of health insurance. That was basically the targeted area. And as we reviewed earlier in the course of the discussion, this was basically a state-run program. It is using the private sector. It's got guidelines as to what the health care coverage should be in various areas, but the states make those judgments and decisions, quite a bit different from the Medicaid program. So this, the origin of it, Mr. President, having listened to some of this debate, it's important to know that this is very different from other kinds of federal programs, not greatly dissimilar from what the President has indicated that he supported in the prescription drug program. And it was initially using the cigarette tax money as that was a part of the settlement earlier. We're using it, and therefore the relationship with the increase in the cigarette tax at the present time. Now, Mr. President, I've only got a few minutes here, and we've gone through these charts about how this has covered 6 million, and we've also reviewed, Mr. President, the fact that if you look at the comparison with adults and children, you'll see that under this program, the uncovered children has gone down dramatically, adults have gone up. So this has been an extraordinary success. The CBO has indicated that this is the best way if you're interested in covering children. The CBO indicated this was the way. The point I want to make in the time that I have, Mr. President, is the point I want to make at this time, Mr. President, is when all is said and done, when we vote, and we're going to vote in just a little while, the American families ought to realize a very important fact, and that is every single member of the United States Senate, with the exception of one, has comprehensive health care, and our children are covered. Do you understand, America? All of our children are covered. All of our children are covered. And next, Mr. America and Mrs. America, your taxpayers' money is paying for 72% of our health care coverage costs. Do we understand that? Now, for those that are saying, well, I'm not going to support this because it costs too much. I'm not going to support this because it may be 300% of poverty. We get paid $160,000. We are well above the 200, the 300, the 400% of poverty level. And yet we're going to have members on the floor of the Senate this afternoon who are going to turn thumbs down to American families that are watching the debate and discussion and knowing that our premiums, our health insurance is being paid for by the American taxpayers. I wonder how people do that, myself. I wonder how they do it. You'd think if they're so offended about federal government spending or a federal government program that they wouldn't use it themselves. But no, they do. They'll take it. But when it comes to looking out at working families, there are going to be many in this chamber that are going to say, no, we're not going to look out at working families. You can pay for mine. Go ahead and pay for mine. I get my children covered. But we don't think the federal government ought to be tampering with this issue. We don't think the federal government ought to be looking into whether it's going to have a program to provide coverage for the sons and daughters of working families that cannot afford a $10,000 health insurance program that would cover themselves and their families, although the taxpayers are paying for ours. Mr. President, this is extraordinary hypocrisy that we are about to see here on the floor of the United States Senate. How can people in good faith do this and still accept the federal government? How can they be complaining all afternoon about a federal government program and then have a better federal program paying for their own? Paying for their own. It is just, Mr. President, hypocrisy of the greatest sort. And that, I think, is something that is important. The most important point has been mentioned eloquently by many of our colleagues as the importance of covering those children. The important point is that too many parents will cry themselves to sleep tonight wondering whether their child is $200 sick because they have to go to the emergency room. That is the heart of this. But before we all get worked up, Mr. President, it's important to know what the financial bottom line on this is, too. Finally, Mr. President, what has been pointed out over the course of the past days, again, is the questions of priorities. And we see this chart here. When we're talking about priorities, that is what this vote is. Do we want to say that we can cover for one day in Iraq, the cost is $300 million, 246,000 children. For 1 week, $2.5 billion. 1.7 million children. 41 days, $12.2 billion, 10 million kids. This is a choice. There are those that want to continue the ongoing flow of resources to Iraq when we have asked our military to do everything they could, and they have done it with great valor, and still Iraqi politicians cannot get it together, and they're holding American servicemen and women hostage. And the blood of American servicemen is flowing in Baghdad, and this is wrong, Mr. President. This is an issue of priorities. I believe we ought to invest in the children, and I think we have benefited enough here in the United States Senate from our own largesse, from the federal taxpayers in terms of the supporting ourselves, that we should be ashamed if we cannot see the responsibility that we have to look after children of working families in this country. I thank the Chair.